Hello, my name is Cibrian Johnson, and the title of my study is Families First, Impacts on Parent Knowledge and Association Between Program Quality and Child Symptom Severity. When it comes to parenting programs, research suggests the more knowledge participating caregivers gain, the more effective the parenting program is. Parenting programs delivered with high quality are associated with successful program outcomes in regard to the child and the parent as well. One parenting program for caregivers of children diagnosed with ASD is Families First. Families First is a free workshop program for caregivers of children newly diagnosed with autism spectrum disorder. It provides caregivers with resources and strategies to help make teaching daily activities and child independence easier. The workshops are hosted at the main site, which is Vanderbilt University, and is webcasted to remote sites. So the current study will assess 3 research questions. The first one is, do parents participating in the Families First workshops at a remote site experience an increase of knowledge from beginning to the end of the workshop? Second, are quality ratings of comfort, satisfaction, and facilitators associated with measures of knowledge and child symptom severity? And lastly, is child symptom severity associated with measures of knowledge? So the participants for this study were parents and caregivers of children diagnosed with ASD from rural and semi-rural Kentucky. We had a sample size of 49. Workshops were held in a building on campus at a Southern University, which is a Families First remote site, and free childcare was provided. So we used 3 different types of measures for the study. The first one being the content knowledge quizzes. That is a 10-item quiz that measures pre and post knowledge of content specific to the workshop, with higher scores indicating more knowledge of content. The 3 different types of quality measures used were the Service User Technology Acceptance Questionnaire, or the SUTAC, which was a 6-item scale that measures caregivers' perceived benefits of the workshop, with higher scores indicating greater perceived benefits. Secondly was the Telehealth Satisfaction Questionnaire, or the TSQ, which is a 6-item scale that measures caregiver satisfaction with the workshop, with higher scores indicating greater satisfaction with that workshop. We also use the Facilitator Rating Profile, or the FRP, which is an 8-item scale that measures caregivers' perceptions of on-site facilitators, with higher scores indicating greater positive views of facilitators. We also used a 3-item scale to measure child symptom severity, with higher scores indicating greater symptom severity. So when families arrived to the workshops, parents were asked if they wanted to participate in the research study. However, that did not impact parents' ability to participate in the workshop itself. So the parents that did choose to participate gave informed consent, and they completed a demographic survey, the quiz, and ratings of child symptom severity. After the workshop, caregivers completed the quiz and the quality measures. For the analyses, in regard to the research question 1, a repeated measures analysis of variance was conducted to examine whether there were significant increases in content knowledge from the beginning to the end of the workshop. The effect size used was colon C. In regard to the research question 2, Pearson's R correlations were calculated to examine the associations between the measures of quality, the quizzes, and symptom severity. In regard to research question 3, Pearson's R correlations were calculated to examine the associations between measures of child symptom severity and content knowledge from the beginning to the end of the workshop. So moving on to the results, to answer research question 1, we found a significant difference between quiz scores from pre to post workshop, and there was a large effect size. It appeared that parents increased their number of correct items by 1 or 2 by the end of the workshop. To address the second research question, when we looked at the associations between the quality measures, content knowledge quizzes, and child symptom severity, we found 2 significant correlations. So the first one was a negative correlation between symptom severity and the SUTAC, meaning that as symptom severity scores increase, ratings of quality moderately decrease. The second correlation was a positive correlation between 2 quality measures, the FRP and the TSQ. This indicated that as ratings of facilitator satisfaction increased, ratings of workshop satisfaction increased as well. To address the third research question, in which Pearson's R correlations were calculated to assess associations between symptom severity and the content knowledge, no statistically significant correlations were found between the pre and post test and the child symptom severity. So looking at the study overall, there were some major takeaways to note. The first one being, when it comes to Families First workshops, caregivers consistently experience an increase in their knowledge by 1 or 2 items related to the workshop topic. In regard to research question 2, the more severe the parents rated their children's symptoms, the less benefits they perceive gaining from the workshop. Also, the more satisfied caregivers are with the facilitators, the more satisfied they are with the workshop overall. And lastly, in regard to research question 3, the severity of child symptoms appeared to be unrelated to the gain in content knowledge from the beginning to the end of the workshop. So that is the end of my study. Thank you so much for your time.